Good afternoon, everyone. My name is Amanda Gunter, and I'm one of the directors here at Brain Balance. And I just want to welcome you this afternoon to a webinar called Addressing Anxiety, a deeper look at the role of brain connectivity when it has to do with the diagnosis of anxiety. Or maybe you have a child or a young adult that doesn't have a diagnosis of anxiety, but yet they are truly struggling with symptoms of anxiety. I want to give a shout out today. We have many centers participating in today's webinar. So we've got Chula Vista, Encinitas, Palmdale, Redlands, San Diego, California. We have Norwalk, Connecticut, Wilmington, Delaware. We have Central Florida, Coral Springs, Jacksonville, Naples, Palm Beach, and West Chase. We have Peachtree City, Roswell, and Suwanee, Georgia. We have Boise and Eagle, Idaho. We have Edwardsville, Illinois, Plainfield, Indiana, Overland Park, Kansas City, Wichita, Kansas. We have Louisville, Kentucky, Oakland County, Michigan, Chesterfield, Missouri, Woodbury, Minnesota, Omaha, Nebraska, Summit and Bergen County, New Jersey, Plainview, New York, Charlotte and Cornelius, North Carolina, Columbus and Cincinnati, Ohio. We have Wexford, Pennsylvania, Farragut, Nashville, Tennessee, Allen, Fort Worth, Texas, Midlothian and Glen Allen, Virginia, and Mequon and Fox Valley, Wisconsin. So we have all these centers that are participating in today's webinar. And so they have a texting phone number. If you have a specific question, reach out to one of these centers that's nearest you and ask them the question, and they will be able to answer. We have many ways for you to participate in today's webinar. I'm going to be asking poll questions. You probably saw the first one pop up, and it says, is this your first time joining us for a webinar? And it's amazing. 71% of you guys are saying, yes, this is your first time joining us. So welcome. And 29% of you guys say, no, you've been on another webinar of ours. So welcome back. We also have a Q&A box. And so if you have a question that you feel like could be helpful to be answered, go ahead and throw it up in the Q&A box. We have several moderators that are on today to answer your questions. And then if we have time at the end, I will answer some questions live. So again, throw up questions in the Q&A box, text your local center, and then participate in our poll questions. That helps me be able to speak to you guys and hear where you're coming from. And I love when it's interactive. So, so please participate, and we're excited that you're here. Here's another poll question. Who is it that you are concerned about that's struggling with anxiety? Do you have a child that you're concerned about? Perhaps a teenager? Maybe you have a young adult that's maybe struggling with anxiety that's impacting their success in being independent. Or maybe it's yourself as an adult struggling with anxiety. So we serve a wide array of people, from children to teenagers to young adults, and we launched an adult program about 2 years ago. So there's several different programs that we have available dependent upon age. So looks like 70% of our clients today, or our listeners that are on, are concerned about a child. And that's what we're going to be talking about today a lot, our children. But again, this information can pertain to teenagers and young adults as well. So let's get started. Children that struggle with anxiety oftentimes do not know that they're actually feeling anxious. But what they do describe for you is more about what they feel. Okay, so you may be hearing from your child, I can't sleep, I don't feel good, my stomach aches. Perhaps they're going to the nurse constantly at school. I'm scared, I feel nauseous, like I'm going to throw up. I have headaches, and they don't want to come out of their room. Or maybe as they're becoming teenagers, maybe they do say that they're feeling nervous. But many times children really aren't able to articulate what anxiety, that it's really anxiety, right? It's more about what they're feeling, what they're physically feeling. And many times it's not just a tummy ache. There could be other things that are going on underneath that are causing these physical symptoms. Did you know that anxiety disorders are actually one of the most common psychiatric condition in youth today? Of course, we're seeing more and more of a rise post COVID, but it's something that we're seeing in the centers significant increase of. 7.1% of children aged between the ages of 3 and 17 actually have a diagnosis of anxiety, and that it actually is affecting over 25% of children between the ages of 13 to 18. So you can see that there's actually a huge increase in those teenage years. And you have to ask yourself, how is it going from 7.1% to over 25% when you're working with and you have a child that might be a teenager between the ages of 13 and 18? What the research also shows is that it actually leads to significant impairment related to academic performance, related to social situations, and it also can impact overall family functioning. That children with anxiety are actually at a higher risk to perform poorly when it comes to school and academics. They often will miss out on social experiences. And I always like to say that experiences create neural pathways. And so if they are actually not engaging with peers and with friendship groups, that actually is impacting the way that their brain is developing. They also have a greater risk for drug and alcohol problems in their teenage years and going into young adult. Because what ends up happening is when they are feeling so anxious, their body is so uncomfortable and their brain is on overdrive, which we're going to talk about today, that they're utilizing substances to feel calmer, to feel better. And that is oftentimes what happens related to drugs and alcohol. So that is something when you're thinking about, okay, if I have a child that's in fourth grade and fifth grade, and we're struggling with anxiety now, what is that going to look like in middle school? What is that going to look like in high school? And then just understanding that there's a greater risk for them to be impacted by drugs and alcohol. Here is the DSM-5 criteria for anxiety. Now, the DSM-5 is really the diagnostic criteria. So to get a diagnosis of an anxiety disorder, they have to qualify under this definition. It says that there's excessive anxiety and worry occurring more days than not for at least 6 months, that it's about the number of events or activities such as work and school performance. So it's something where they can have anxiety in multiple environments over a longer period of time of 6 months or more. Other symptoms that they may have are like restlessness or feeling on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. So again, to get this diagnosis, your child would have to have several symptoms of the anxiety that's listed below. And then also, it needs to happen in multiple environments over a longer period of time. Okay. So that's the way that the criteria is listed to have a diagnosis. That really gives you the what, right? It's okay. If I'm seeing my child have excessive worry, or perhaps they are avoiding groups and group activities and having difficulty with friends, or maybe there's social anxiety where they struggle with being in groups and knowing how to interact with their peers. Perhaps you may see nail biting or hair pulling or picking skin or crying before school or refusing to go to school. Or, like I said, those frequent trips to the nurse's station. Perhaps there's stomach aches or nausea, vomiting, and fatigue. Again, these are just lists of symptoms. These are things that you as a parent are seeing and experiencing every day. But at Brain Balance, we want to look at why, because oftentimes you are seeing the what. You are actually seeing and experiencing all of these things, or that your child is experiencing these things. But we really want to have an understanding of why. Why is your child struggling with these symptoms? And so the first thing that we look at Brain Balance is we look at things from a developmental perspective. So, how is your child's brain developing? All right. Where are their strengths in brain function and development? And then are there any underdevelopments that could be impacting their processing and the way that their brain is processing? At the end of the day, it's all about optimal processing in the brain. It's all about optimal connectivity in the brain. We need the brain to be able to perceive sensory input appropriately. The brain needs to be able to process it so then it can respond appropriately. All right. So when we think about optimal processing, we really want to look at things, like I said, from a developmental perspective. So, are there anything that could be inhibiting optimal brain development? So, one of the first things we look at are primitive reflexes. Now, primitive reflexes, every child's born with them. They facilitate in the birthing process because in a baby, their brain isn't fully developed. So, these primitive reflexes are involuntary motor movements, okay, that originate in the brainstem and that are present after birth in early child development that facilitates in survival. Basically, that means that they're involuntary motor movements. So when we assess for these in our centers, we're looking to see, are these involuntary motor movements still active? Because again, as the brain develops between birth and the first 18 months of life, these primitive reflexes are initially active, but then as the brain develops, these primitive reflexes actually should be inhibited to where they are no longer active. So we're going to go into a little bit deeper dive of primitive reflexes, but this is something that if they are active, it can inhibit development. It can inhibit development in your child's sensory systems, so their auditory system, their visual system, their ability to smell, their ability to feel. It can also inhibit the development of their motor systems, gross motor, fine motor. So for optimal processing in the brain, okay, your child's brain needs to have optimal sensory processing. So their visual system, their auditory system, their ability to smell, their ability to feel needs to be developing optimally. And their gross motor needs to be developing optimally, and their fine motor needs to be developing optimally. So think about a baby, right? And when you have a baby, you have like all these different toys and all these different activities that are sensory driven to help develop the brain, right? Because what a baby sees, hears, smells, and feels develops the brain. Then think about a baby in motor development. They lift their head, they roll over, they sit up. They're supposed to crawl for 4 solid months. They start standing up, they start walking. We get really focused on motor development in our young children and babies, but oftentimes parents don't realize that motor has to continue to develop. So I love to give the example of children playing soccer, right? If you have a bunch of 4-year-olds on the soccer field, I don't know if anybody's ever watched 4-year-olds play soccer, but it's quite hilarious They're tripping over each other. They're bumping into each other, right? They're kicking the ball, but it's like a swarm of kids going in one direction. And they know that the ball just goes into a goal. And so they're just learning how to kick a ball and get it to the goal. But then think about a 7 or 8-year-old playing soccer. They now know there's teams. They now know who their teammates are. They now know they need to pass the ball to their teammates. They now know that there's one goal that's their goal, right? So their motor movements are becoming more sophisticated. Then think about a middle schooler playing soccer. Their footwork becomes more sophisticated. They start psyching out the other teammates. It's just a more competitive game. And then think about a high schooler playing soccer and a college student playing soccer. So gross motor needs to continue to develop. So one of the things that we look at is we really want to look at your child's muscle tone. We want to look at their body awareness, their coordination. I often say a coordinated body is a coordinated brain. Okay, so if your child is not interested in sports, or they're not interested in being physically active, or you feel like they're very sedentary for their chronological age, that can be a red flag for some underdevelopment in the brain taking place. And then think about 2 years old, right? They start pointing, they start grasping, big crayons, they're coloring all over the place. Sometimes the wall becomes their art palette, right? And that's a developmental milestone, but it's like, they're coloring on the wrong things. I had my friend actually send me a picture the other day. Her son colored on their sofa with a marker. So these are the things where fine motor also is something that develops. Well, in the brain, the more sophisticated the motor movement is. So again, coloring on the wall versus coloring on a piece of paper versus coloring in the lines versus writing their name really big and crooked versus their name becoming smaller, their letter formation becoming smaller, their handwriting looking strong and improving. All of that gives you insight in brain development. So when we're looking at, again, how does anxiety play into this? Well, at the tip of the iceberg, these are a bunch of symptoms that you're experiencing. When we're looking at how your child's brain is processing, all of these key foundations need to be developing appropriately to have appropriate and optimal processing. So if your child has a primitive reflex, for example, as we call the Moreau reflex, okay, this is something that can easily shift your child's nervous system into responding out of fight, flight, or freeze, which it creates a state of heightened alertness. Their sensory systems become very heightened, where maybe perhaps they can't handle the noise or the sounds, or they have clammy hands, or they have dilated eyes, or their heart rate is pounding. And yet it's a neurological response. Those are also elements related to anxiety. Okay. And so what we see is that if there are active primitive reflexes, it can shift your child's nervous system to respond out of fight, flight, or freeze, which inhibits the reasoning, where they respond out of emotions. All right. And then it inhibits learning. It inhibits social and emotional development. It inhibits and can cause failure to launch in the future. It can cause them to struggle with change because their whole body and their nervous system is functioning out of a state of anxiety. And so this is something that we have to look at is, again, when we're looking at why does your child show symptoms of anxiety, we have to look at it from a neurological perspective because their nervous system can easily be dysregulated. Here's a question for you. Has anyone explained anxiety to you through the lens of primitive reflexes, because there are many primitive reflexes that, number one, inhibits development of the brain, but also can cause the brain to shift and to function out of the survival area of the brain, the emotional area of the brain. So this is where you can see heightened meltdowns and irritability, and where they're not able to cognitively reason with you, where they respond out of emotions versus being able to reason and critically think appropriately. Wow, 81% of you guys say no, that you've not heard this. So this is something that we look at Brain Balance, because again, we want to give you answers. We want to give you answers of why your child may be struggling with anxiety. Now, the next element that we look at when we're really looking at how your child's brain is functioning is we want to look at the connectivity of the brain. I often say a balanced brain is a teachable brain. Okay. And each brain has two hemispheres. We have a right hemisphere and we have a left hemisphere. And they have different functions, and the different sides have different functions. But what's interesting is that they're complementary functions. And at the end of the day, they need to be equally developing. They need to be cross communicating effectively and efficiently. And you need to be building strong connections between the right and left hemisphere. So when we think about the hemispheres of the brain, we think about right brain is often what I like to say is an example of the brake pedal. It's that ability to be able to stop and think before acting. But your right hemisphere of the brain is also about seeing the big picture, global coherence. It's about reading facial expressions and nonverbal cues. It's about those social skills of being a friend and give and take in a friendship, and the ability to be flexible is more of a right hemispheric function. It's the area of the brain for your EQ. So again, that emotional intelligence. The right hemisphere of the brain is also about controlling impulsivity. It's that ability, again, to stop and think before acting. It's that ability to be able to physically feel your body. Academically, you really need to have strong right hemispheric functions related to reading comprehension, math problem solving, and even written expression. So when we think about reading comprehension, it's like identifying the main idea and understanding inferencing and drawing conclusions from what you read. And then math problem solving are all those word problems. And then we have the left hemisphere of the brain. And I like to compare it to like the gas pedal. It's really more of that processing. It's about linear and logical thinking. It's about remembering facts and details. It's about memory and just being able to remember. It's also about verbal communication. The left hemisphere is more about IQ and intellect. It's being able to recognize patterns. It's also about motivation. It's also about auditory processing, visual processing. Academically, it's more about numeration, so addition, subtraction, multiplication, division, algebra. When we come to reading, it's more about letter recognition, letter sounds, phonemic awareness, spelling, and grammar. But what's important is that both hemispheres of the brain need to be cross communicating effectively and efficiently. They need to both be also developing to be able to cross communicate effectively and efficiently. So many times what we can see is we can see where children can have some extreme strengths, where they're functioning above their chronological age in certain areas, or they're completely on par for their age appropriate function. But then there can be other areas of the brain that's underdeveloped, and maybe perhaps they're not functioning at their chronological age. And so what the research says is that when you have this taking place, you can have what we call a functional disconnection taking place in the brain, where the brain's not able to cross communicate effectively and efficiently. And that one hemisphere of the brain can even mature faster and can even become overworked, right? And then the other hemisphere is not able to keep up. And so that is something that we look for related to brain balance. Oftentimes, symptoms of a right brain weakness is that you can have a child that has difficulty with reading facial expressions and struggles with nonverbal skills. They can be anxious and hyperactive. They can be clumsy and awkward physically. They can lack emotional control. They have difficulties with emotional regulation. They can be obsessive and have repetitive behaviors. They can have just overall emotional immaturity. Again, they can lack interest in sports, difficulty missing the big picture, and they can also be a space invader. Oftentimes, children that are struggling with anxiety that have more of a right hemispheric weakness, they really just struggle with anxiety across the board. It doesn't really matter what the situation is. It's more that they're just overall struggling where anything can become anxious. They can be anxious over anything, or maybe they're just anxious and there's nothing to be anxious about. Because your right hemisphere of the brain is a lot about regulation, emotional regulation, inhibition. And so when there's a weakness in that area of the brain, again, they can have an overactive thought process where they're constantly thinking, thinking, thinking. They can struggle with sleeping, where they're not able to turn off their thoughts. And they don't even know why they're anxious. They can just always be on edge and always be on angst. Whereas children that struggle more with a left hemispheric weakness, these are students that often are aware that they're struggling academically. They can struggle with math skills, the ability to read, the ability to spell. They can struggle with fine motor functions, verbal communication. So they might be really quiet and not able to really articulate what they're feeling. They can struggle with overall just motivation and having the motivation to follow through on things. Oftentimes, children with a left hemispheric weakness that struggles with anxiety, it can be more situational. You can see where they're anxious specifically about school, when it comes to learning or test performance, where they can have test performance anxiety. And they can struggle with being able to verbally articulate. They can have a lot of feelings, but yet struggle with being able to put words to those feelings. So that's something that you have to consider. All to say, you can see weaknesses on both hemispheres of the brain because when you think about how the brain is developing, when there are underdevelopments taking place, it absolutely is going to impact both hemispheres of the brain. Because again, the two hemispheres are not going to be able to cross communicate effectively and efficiently. So here's another poll question for you. Now with a better understanding of the hemispheres of the brain, did you see other areas of concern addition to anxiety? Oftentimes it's like the symptoms that cause the most concern are the ones that you focus on, right? But there may be some other things going on that you may not be as focused on, but you're like, yeah, ooh, they're struggling with that or they're struggling with this. And then what additional symptoms are you seeing? Is it related to focus and attention and academic concerns? Is it challenging behaviors? Maybe perhaps it's social and emotional immaturity or lack of motivation and poor self-esteem. Or maybe you're like, Amanda, it's all of the above. We're struggling and we're on the struggle bus in multiple situations, right? Like that's something too that's very common that we hear in our centers. So let's see what you guys say. And just like I said, is that definitely you can absolutely see difficulties on both sides because, like I just shared, the brain isn't able to connect effectively and efficiently. So you can see symptoms on both sides. So, sure enough, 93% of you guys say yes, there's other concerns outside of anxiety. And what's fascinating is that 48% of you guys say it's all of the above. And we get that. We commonly get that feedback when we're meeting with families in the center. So here's what the research is saying. What's really going on? Why is your child struggling with anxiety? Well, it says difficulty with behavior, focus, memory retention, academics, life skills, social skills often come down to a lack of brain connectivity. And so that's what we really want to focus on related to brain balance, is being able to develop a brain to optimize connectivity in the brain, optimize processing in the brain. So then your child's brain is teachable. But then also, too, that their nervous system can become more regulated so they can be more in a rest and digest state where they're able to access the area of the brain related to reasoning and comprehension. So, how do we strengthen brain connectivity? That's always the famous question, right? Well, here's what the research says. The research says that it takes multi-sensory stimulation simultaneously with increased intensity over a period of time. We want to strengthen, okay, the weak areas of the brain so that we can build better brain connectivity. And we've got the research that shows what we do is effective. We are a drug-free, multimodal, backed by research program. So when we're talking about, okay, what does this mean? Multimodal. Well, it means that we have to activate your child's brain through all of their sensory systems. So activate their brain through their auditory system, their visual system, their ability to smell, which we call olfactory, the ability to physically feel, so tactile stimulation. And then also, we want to strengthen their brain and develop the brain through their motor systems, gross motor, fine motor. So, all to say, when we're talking about multimodal, we want to develop the brain through all of their senses and through their motor systems simultaneously. And then with increased intensity over a period of time, is that changing and making things more challenging as they progress is what is most powerful. And then here's what the research says, right? When it comes to our Harvard Medical School in McLean, it basically said that there was a marked reduction in the ADHD index scores when they were post-assessed after doing brain balance. That there was actually, in the full research article, it talks about how there was physical brain change that occurred after children participating in the brain balance program. So that's what we want, right? We want a brain that's teachable. We want a brain that is connected, because a connected brain is a teachable brain. Now, we have a whole area on our website that explains further all of our research papers and our outcome studies. So again, what the overarching element and the overarching message is that we need brain change, which we're definitely physically doing, but then also we want to see behavioral changes. We want to see academic changes. We want to see an increase of your child having confidence and having a higher self-esteem, right? Because that's what you want. You want your child to be happy and healthy and being optimistic and being able to experience their friends and go out and play and have these social experiences, because we're social beings, right? And so for a child to be truly happy, they need to be able to connect to others, connect to you as family, and not have the barriers of the fear and anxiety that maybe they're experiencing today. Here's a poll question for you. Where do you see your child, teenager, young adult really struggle with anxiety the most? Is it in the morning? Is it at school? Is it socially? Is it at nighttime? Or is it at all of the above? And the reason why we ask this question is because, again, when you're looking at, okay, is my child struggling with anxiety more situational, or are they struggling with anxiety across the board? And that's something that we look at. Granted, it's all back directed to related to how their brain is functioning and the connectivity in their brain, but it also gives us insight into what areas that we need to focus on. So sure enough, Many of you guys are saying that 40% of you guys are saying all of the above, that it's in the morning, it's at school, it's socially, it's at night. And that's oftentimes what we hear. And that's why we have to look at it from a developmental perspective, and we have to look at it from a neurological perspective. Because if they're anxious constantly, their nervous system is dysregulated. And so that's where we want to look at developing a plan of action to get better regulation. Now, here are some simple things and strategies that you can do at home. All right. We experience our environment through our senses. So you want to make an environment that's positive. Okay. And we all know that the news is not positive, right? I mean, they get their ratings from drama. All right. So, one of the things that I really encourage you to do is take the news off the TV. All right. Our kiddos don't need to be listening and hearing all of the situations that are going on outside of their control, especially for a child that's struggling with anxiety, right? Of course, current events are important, and they're important to process, and they're important to talk about. But specifically, if you have a child that's struggling with anxiety, you may want to take a break. You may want to take a break from the news and really be able to put on positive messages, positive music, really singing, really trying to create a positive atmosphere. Also, remember that motor develops the brain. So the more that you can integrate physical activity throughout your child's day, the better it is. And then there's also research around chewing gum, that actually chewing gum can be an anxiety buster. So this could be a great tool and technique to utilize when you have a child, or maybe y'all are going somewhere that you know is going to cause anxiety, maybe the doctor's office or the dentist. Chewing gum can actually release and reduce cortisol levels. And that is something that is super helpful when it comes to anxiety. Now, you guys will be getting this helpful handout where we have a bunch of different activities that you can do. Activating the brain through your child's sensory systems, activating your child's brain through their motor systems, all of that is going to be super helpful to reduce anxiety. Now, here's the thing. We have even more resources for you outside of just the anxiety guide. So I encourage you to contact your local center for more helpful resources. We have specific music that can help activate the brain, specific smells, specific colors. We have a whole guide on physical activity, creating a sensory travel kit that could be helpful in stressful situations. So I would encourage you to reach out to your local center, let them know you've watched the anxiety webinar and that you want to get as many resources and guides as possible emailed to you. But here's the thing, at the end of the day, right? If you've been listening to this webinar and you're like, Amanda, this makes so much sense. Like, I really have a better understanding of why my child could be struggling with anxiety, then I would encourage you to take the next step, because when you call the center and you book an appointment, we can actually give you specific information on your child. We can look at, does your child have primitive reflexes that's inhibiting development, that's causing their nervous system to shift into fight, flight, or freeze? We can also look at their sensory systems, the way that their brain is perceiving sensory input through the visual system, their auditory system, their tactile system, their olfactory system, which is smell. Then we can also look at how that brain is processing these senses. And then we also look at their motor functions, gross motor, fine motor, really providing you clear information of what your child's developmental brain age is versus their chronological age. Where are their strengths in brain function and development, and where are there maybe underdevelopments that are taking place that's causing the symptoms that you're seeing and experiencing? We also can look at your child's visual system related to reading. We can also look and explain why perhaps you're seeing the behaviors you're seeing. And then from there, we really want to put together a customized plan of action with you to improve your child's brain function. So the next step, though, is just to get answers of why your child may be struggling, and then what the plan of action could be to really see those outcomes that you want. Less anxiety, your child more happy, your child having stronger self-esteem, your child being able to be confident in social situations, your child's ability to be able to maintain focus and attention and be able to gather all the information at school that they need to be able to finish their homework and be able to not be anxious about taking tests, perhaps. So again, it's all customized based on what's going on with your child. But again, the next step is just to get answers specifically about your child. Again, like I shared, we have centers all over the US that are participating in today's webinar. And also, we have this same presentation tonight at 8 p.m. Eastern. So if you have a friend, a family member, perhaps your significant other, your husband, your wife, and you're like, oh my gosh, they need to watch this, they need to read this, I highly encourage you, get them on the webinar. It's definitely something that's going to be super helpful. And then next month, we're going to specifically be talking about bad grades and the impact of learning struggles specifically related to self-esteem and mental health. We are in a mental health crisis in our country, especially with anxiety, but also related to self-esteem and learning. So that's something that we're going to be offering you next month. But again, tonight we are here, 8 p.m. Eastern. I'll be doing this presentation live again. And again, we just want to encourage you, reach out to your local center. They can provide you even more in-depth information. Now, I think we have a few minutes for some questions live. So let's see what you guys are asking.
Thanks, Amanda. And we have had some awesome questions throughout this presentation. So if we don't get to your question, please reach out to your local center. They are more than happy to answer your specific questions. One of the questions that we've gotten is, what if the only symptoms of anxiety that a child is experiencing is more physical? Things like saying that they're shaky before something that might be difficult, or that they're nauseous, or that they're dizzy. Is that still anxiety? Is that still a brain imbalance? And how would families determine that?
Well, to fully determine it would be to, go to a center and have an assessment done. But those physical symptoms of shakiness and things that you just described definitely can appear to be that it's a neurological response. Your nervous system is connected to your digestive system. Your nervous system is connected to heart rate, body temperature, clammy hands, dilated eyes, all of that, all of those physical symptoms, stomach aches, dizziness, headaches, all of that can be related to a dysregulated nervous system, which is connected directly to the brain. So, so absolutely, that would definitely be something that a center can help you with, and again, get you the answers of why perhaps your child is experiencing those symptoms. Good question.
Thanks, Amanda. And what is the age range that we look at for assessments and evaluations, as well as the program?
Sure. So we start working with students and children at the age of 4 years old, and now we go all the way through adulthood. So, primarily, I would say, the populace of in centers tend to be between, the ages of 8 and 14, 15, but we serve all ages, and there's benefits for If you have a young child, that maybe is 4 and 5 years old, well, guess what? Their brain is young and still developing, and perhaps their underdevelopments aren't as significant because they're so young, right? Whereas a teenager, their brain is more physically developed, but what we see is that because the brain is more physically developed, it actually can respond very powerfully to our program. So there are benefits for both ages coming into our center for different reasons, but it is a powerful program no matter if they're young or they're teenagers or even as adults. That's what's the beauty is that we now know that the brain can change through the study of neuroplasticity. And so it doesn't really matter what age you are, it just matters about getting a plan of action to be able to improve overall brain connectivity and brain function.
Thanks, Amanda.
Mhm.
For families that have children who have other diagnoses like ADHD or autism spectrum, what is the difference in these different diagnoses? And do they all ultimately boil down to brain connectivity?
Absolutely all boil down to brain connectivity. Yep. So again, we're looking at where are their strengths and where are there maybe perhaps weaknesses in brain connectivity, where there's under connections in the brain and even over connections in the brain that's impacting brain connectivity. So it does. It really comes down to a lack of brain connectivity and the brain functioning optimally, cross communicating effectively and efficiently. We do not diagnose at Brain Balance. We really look at, again, where are their strengths, where are their weaknesses, and then put together a customized plan. So we absolutely serve children with multiple diagnoses, and a wide array of diagnosis. Yeah.
Thanks, Amanda. For older kids and teens who are really struggling to put words to how they're feeling, and parents are constantly hearing, I don't know, and they're
Mhm.
not able to articulate those emotions,
Yeah.
what can they be working on at home right now? And really what is happening that's causing that I don't know answer?
Yeah. So one of the things we look at in the center is, can your child physically feel their body? It's actually quite remarkable how many children are not physically feeling their body appropriately. Either they can be hypersensitive or they can be hyposensitive. And there's reasons for both, which, we explain, but oftentimes, when kids are struggling with body awareness, then they're not going to be able to describe what they're feeling. And they're absolutely not going to be able to tell you why. And so many times parents get into the why trap, is what I call it, where you're really wanting to know why. You're really wanting to know why your teenager's acting this way or, doing this, and they don't know why. And it goes back to a lot of times just a lack of body awareness, and the ability to physically feel their body. So these are things that we have to work on to improve their body awareness and to be able to, see improvement in their ability to articulate verbally what they're feeling. Um, and so it's really, I'm trying to think of a story. With a specific student that we've been working with, a very concrete example would be if you had a child that when they bump into things or they hit their head or they fall down and scrape their knees, that they don't really respond appropriately. They don't cry, or you're kind of like, oh, that had to hurt, and yet they kind of just keep going, right? So those are early physical signs of your child not physically, feeling appropriately. Then, as they become older, it a lot of times shifts into the emotional elements, right? Where you're trying to get them to talk about what they're feeling, and yet they're not able to articulate that. So what we see in the center is that we actually have to see physical changes in their ability to physically feel their body, And that is actually the foundation for social and emotional development. And also the development of empathy. If you see where your child may struggle with being able to empathize, perhaps that the choices that they make can impact not only themselves, but other people, their siblings, maybe you as parents, maybe their friends. Having that lack of empathy is also an indicator that they're disconnected from themselves. And so, the primary of that is the ability to physically feel your body. So, it's a little bit of my soapbox, but it's something I'm really passionate about. But it's phenomenal to see the changes because the more they can connect to themselves and be able to describe what they're feeling, the better they're going to be able to self-evaluate from the choices that they're making and how it impacts themselves and impacts others, to being able to empathize with other people and being able to put themselves in other people's shoes and situations. So it's really powerful. Yeah, good question.
Thanks, Amanda. Could you give some examples of some of the activities that a child would do during their assessment?
Sure. So some of the activities are on the computer. The assessments are on the computer, looking at their visual system. So we would be looking at, different elements related to their visual system, the motor movements of their eyes, the ability to fixate their eyes. We really want to look at also visual processing. And then we really want to look at their auditory system. So it's a series of, listening activities. Um, and then, of course, we want to look at their motor systems. So, looking at body awareness, looking at core strength, looking at muscle tone. So, it's a very interactive assessment process that kids tend to enjoy because they're not sitting there, at a table answering questions. They're actually moving around and they're doing a bunch of different activities. So it's really fun and engaging, and they really seem to enjoy it. So that's also, good feedback that we have when we're looking at different elements. So that's great. Great question.
Thanks, Amanda. For our attendees today that have children that are under that age of 4, but are seeing the signs of anxiety happening, what are some things that they can be working on today to help, boost that optimal brain development?
Sure. So I would encourage them to definitely call the centers and ask for the guides. And then in the guides, we give you very concrete things related to music that helps activate the brain and the area of the brain to reduce anxiety. Even smells that you can have your child, do to be able to help activate the brain. And then the biggest piece of advice I would say is to reduce screens, because that is something that can cause a lot of anxiety. So reduce their screen time and then trade that with a lot of physical activity, a lot of physical play, going to the playground, climbing, jumping, just engaging their big motor systems as much as possible. Will help activate the area of the brain to reduce anxiety. And so, those are the things that we have to be careful about, is that screens can really be impactful for a child that is struggling with anxiety. So keeping that down to about an hour a day is what's optimal. And I always encourage, television is much better than an iPad. And so those are just little, environmental changes that you can be making. But the guides are super helpful because you can, again, activate that brain through all of their senses. So through their auditory system, their visual system, their olfactory system, through their motor systems, and just driving. I say motor, motor, motor is your mantra. So driving those big motor systems can be super helpful for young children. Good question.
Thanks, Amanda. For families that are really considering the Brain Balance program as an option for them, but are concerned about how the staff will be able to motivate their child or how they'll be able to work through, their kid shutting down or that teen that may not want to come in,
Mhm.
how do the centers handle those situations?
Yeah, that's a great question. So we really, we do believe in connecting and making it fun for our young people. But of course, we do have to oftentimes, you might have to motivate your child. I jokingly say every child has currency, right? We all have a currency, right? As far as, what does it take to motivate them? And so external reinforcers oftentimes are needed before you're going to get that intrinsic reward where they want to be motivated because they feel better, right? So we definitely work with families on coming up with a plan of action around that if it's needed. We have all different types of plans and we customize things based on your child's interests. Um, and then, what was the second part, Jess, of that question? How do we motivate? And then there was another piece to the
And
question.
then for those kids who maybe shut down
Oh, and the teenager.
or are teens who just don't want to come in, those
Got
types
it.
of situations.
So teenagers, those are my favorite age group personally. Everybody has their favorite, right? But with teenagers, it really has a lot to do with explaining the whys. So for them to understand the different activities that they're doing and how that activates their brain and changes their brain, and you got to make it cool. You have to make it where, again, speak their language. So if they're motivated and they want to become a musician, then we can talk to them about how the different elements of the program will help them become a better musician. So again, you have to really see what their interests are, and then educate them and inspire them that, hey, to have optimal brain health, you will be able to accomplish X, Y, and Z. It might be as simple as that they want to get a driver's license or they want to feel more secure and be more confident with making friends, right? So a lot of times we want to talk with them to see what their goals are, and then really be able to communicate, okay, we're going to be doing these things, and this is how it's going to help you be able to get to the goals that you have. And sometimes, I mean, we have teenagers that have no goals, that they're completely shut down, and it's really hard to get them to even think about what they want to do. Um, and so that's, again, I love those cases and those challenges. And so a lot of times it's about building relationship, and building a foundation of relationship and trust, to get them to start working for you. So, um, you know, there's always, where there's a will, there's a way. And we work really hard with every family to try to create a customized plan that works for your child and works for your family. So, all right. On that note, I just want to thank everyone for participating today. Again, we will be here tonight, also at 8 p.m., 7 p.m. Eastern. And again, if you have somebody that needs to hear this or you want them to listen in, go ahead and sign them up, and we will be here tonight again to have the same presentation. So thank you so much for taking time to listen to this webinar, participate in the webinar. It was awesome. And we hope to hear from you soon. Thank you, everyone.